hello, hello, hello. Woo! I'm on. Listen, welcome to SHEM Ministries. Oh my gosh. I have worked so hard to try to figure out how to avoid the technical difficulties we had on last week. So I ended up in this little area in my home because I needed to isolate myself from other devices. So please forgive me. I am Dr. Anna Devlin, and I would ask that you just keep working with us. We are a work in progress, all for the kingdom, for the glory of God. We try to do so much to give you what you need, but if you can't hear it, then so I do apologize on last week. My understanding is that the message was kind of in and out. So here we are tonight. Thank you for being with us. We are SHEM Ministries, that is Souls Honoring Elohim's Mandate. And this is our SHEM 2 night. And of course, that is a spiritual, healthy, enlightening mandate ministry. And we decided that we were going to look nerdy tonight and wear our glasses. We wanted to be studious. Nah, I'm just messing. It's just an allergy season, and putting contacts in was not something I wanted to endure today, just to kind of look a certain way. So this is me. But the things that I have to share with you are what's most important. It doesn't really matter what I look like. It is what I have to say to you tonight. First, we are going to have a word of prayer. Dear Heavenly Father, we thank you, we praise you, and we glorify you for giving us the mind to never give up, giving us the strength to say, oh, no. I got this. Father, you woke us up this morning with so many things in our heart, desire to do for you. And I thank you, God, we have accomplished so much in one day, realizing that tomorrow's not promised. But my God, the thing that you know I love the most is feeding your people, feeding them what they need to understand and know and do whatever it takes to improve their livelihood. So we ask that you just bless the message on tonight, that the words will be well received, that you will spark something in someone, something will be said that will help them understand themselves better. We ask that you bless this ministry. In Jesus' name we pray. Amen, amen. So, and I'm sorry, I accidentally kicked the tripod. Last week, we talked about back pain, get back, okay? And so I am so very thankful for one of our viewers who said, I want to talk about my knee. Okay. So the Lord said, you know what? Let's talk about knees. So tonight, our segment is, are you needing me? Are you needing me? Kneeding. Are you needing me? And the reason that is our subject is because we need our knees in order to walk. Movement is contingent on our ability to stand and to bend our joints. Now, you need your elbow, right? And I need my wrist. You see, it's got a brace on it because we have had some inflammation in the wrist from repetitive movements that I do when I work constantly. Okay. So even I myself know that when repetitive movements, such as with our knees, can cause pain and discomfort. And so that's what we're going to talk about tonight is knee pain. Are you needing me? Yes, you need your knees in order to ambulate and to walk. Now, unfortunately, we don't realize how much we need our knees until they go out. Or if we knew in advance, we would have worn things or done differently, certain things to, anyway, hindsight. You know what they say about hindsight, right? But what we can do is prevent further damage. And if you have one knee that bothers you, maybe we can offset and prevent pain in the other knee. And remember that whatever causes knees to hurt can cause any other joint to hurt. Shoulders, elbows, like I said, my wrists, our ankles. Okay? So, knee pain is a common symptom in people of all ages. There are so many disorders and things that, because remember, as we grow as babies, the bones are growing. So as we grow, we can have pain from growth. We can have pain from injuries. We fell, we twisted children learning how to ride bicycles, they're wanting to play sports, all of these things. Pretty much the number one reason for knee pain is injury and overuse. Okay, but it is a common symptom in people of all ages. It may start suddenly, often after an injury or exercise where you have done too much. That is, Knee pain also may begin as a mild discomfort, then slowly gets worse. So when you get that warning sign, that mild discomfort, you really, really should do something about it. And many times we don't. You can't see me right now, the bottom part of me, but my knees are crossed. I cross my knees a lot. And I will tell you, I have discomfort on my left lateral knee, and it's me crossing my legs all the time when I sit down. So I have to deliberately uncross my legs and try to be mindful of that. So I am going to, you know me now, we got to start with some anatomy. And I want to show you the normal anatomy of a knee. So let's start with that. Yeah, there it is. Okay. Let me see which one I want to show you first. Wait a minute. We'll start with this here because I think this is a better picture. Okay. And I tried to make these pictures as big as possible. But if you look on the left side, there's a lot of writing on this picture. But if you look on the left side and you see this knee here, right? If you look at the top, you see where it says patella, P-A-T-E-L-L-A at the top. And it's where the ligaments, you see the ligaments, which are the white, shiny looking stuff. But do you know the patella is only your kneecap? And the only thing that's holding your kneecap in place are these ligaments. See, it says patellar ligament. All right. And it is also connected, but the ligaments, but remember, muscles have to move the knee itself. So I do have, we're going to go back and forth, but in order for you to understand why your knee is hurting, you first got to understand the anatomy of the knee. You have your quadriceps tendon. So tendons and ligaments hold things in place. And then the muscles are what move them. So if you really, really look at the bones of the knee that form the knee, it's just a bunch of bones sitting there together. If it wasn't for the meniscus, the disc, remember when we talked about back and we talked about the disc between bones, they really wouldn't, and they technically don't touch or shouldn't touch each other. Now, when you wear away the disc in your knee, you get pain and discomfort. So you have a medial and a lateral meniscus, and all meniscuses are like disc. They're the cushiony stuff to prevent your bones from rubbing together. And over time, it's kind of like, you know how you have a pillow, and when you first buy the pillow, it's nice and fluffy and it feels good when you lay on it. And if you've had it for a long time, it don't fluff anymore. It's actually now flat. And what do? We go out and we buy another pillow. Well, think of your meniscuses as pillows that cushion in our knee. The movement, the activity of bending and walking and pressure on the knee. So what I'm trying to say is, over time, if you don't condition your knee, careful how you bend, how you twist, jumping up and down, all this pressure, certain activities, you wear your knee out. Some things can be restorative if you catch it early enough. And some things are, when they're gone. Okay? So you got your kneecap, you have your femur, which is the long bone in your leg that goes all the way up to your hip. Okay? That is what allows you to move the leg and bend the knee. You have a femur that goes all the way, and we talked about this when we talked about back pain. I showed you a picture of the femur in the hip, okay? And so you have the femur, and then below the two bones in the bottom of your lower leg, you have your tibia, Tibia, which is the bigger one, and you have your fibula, Fibula. So femur, fib, okay? So, and most of the time, you'll hear people say fib. Sounds really, really good together. Remember, two bones in the lower part of your leg, fib. Femur, the long bone in your thigh, your hip, up to your hip. And your patella, it just kind of sits there, okay? Now, I'm going to move on to the muscle. And then later on, we can come back to some of the disorders and what causes this and that discomfort. Let's look at the muscles that move the knee, right? Now, in this picture, it shows you even better. See that patella? That's your kneecap. See the ligaments that hold it together and allow them to stretch. And see, a lot of times people, when you get pain in your knee, especially if you twist it a crazy way, you get tears of your ligaments, okay? Tendons and ligaments are many times injured, especially in football and basketball, sport injuries. Now, look at these muscles. Wow. Most people know they have quadriceps. Quad means four, right? You got these muscles that in your thigh. I mean, oh gosh, you couldn't walk without good quadriceps. And they attach to the patella, and they allow the muscles of the upper leg to move the bottom leg. You also have your hamstring in the back. You hear people talk about, oh, I got a hamstring injury, and that's in the back of the leg. I'm not going to get too deep in how the muscle, I just want you to see the picture, so when we talk a little bit about different knee disorders, you'll understand kind of where they're coming from. And so, like I said, the femur is the thigh bone, so it explains it there better. And you see your meniscus on the side there, how it actually, like a shock absorber in between the bones of the femur and the tib and the fib. Okay? All right, so that's that picture. Then let's kind of, I wanted to give you, not that I'm anticipating you'll learn any of this stuff, but I really wanted to show you another picture of the ligaments. This is the anterior, which is the front of the knee. How these ligaments, like you see your femur, you see your patella, the kneecap. Look at all of these epicondyles and the adductor and the medial. Now, let me tell you, the condyles are kind of like, I'm trying to, how to describe them. They look like, they're rounded like, and you can see that there is the medial condyle of the tibia. So each bone has a condyle, okay? And it's kind of like that little protrusion. Let me see what I can do to kind of, it protrudes out. Like if you're thin, you can feel some of the condyles on the side of your bone. It's like an outer protrusion, okay? You got the head of the fibula down there, lateral meniscus. It's just another view. But I just wanted you to see the front of the knee and all that. The blue stuff is the ligaments in this picture. All right, let's go to this one. This is the back side of the knee. This is the ligaments in the posterior. Anterior is front, posterior is back. So, and the point of me showing you this is because most people, when they have knee pain, they don't think about the back of the knee. Like, it's, oh, my knee, and it's the kneecap, and that's it. But you need to look at the back of the knee and see what's there. Now, do you see the cruciate ligament? Most people know the anterior cruciate ligament. And I don't know if you can see it well enough, but the ACL, you'll hear so many people in sports talking about they tore their ACL and how difficult it is to have it repaired and the time it takes for it to heal. And that is the main reason for me showing you that you cannot forget the back side of your knee, okay? So you've got those ligaments in the back that without those ligaments, you can't walk. You cannot. And the movement, they can't move your leg. I can't bend my leg. I lost the ability to do it on my own because there's a tear in the ligament, okay? Or the tendon is stretched, all right? So I wanted to show you that. And now what I would like to do, let's talk about some disorders and things of the knee. Because we all get knee pain at some point in time. All right, now, and I'm going to read some stuff now that I showed you these pictures. We're going to talk about arthritis. And the reason we're going to talk about arthritis is because it is one of the most common causes of knee pain, especially chronic knee pain. When I was saying something about, mild discomfort, we don't pay attention to it, and then all of a sudden it progresses. It's because over time, inflammation, anything that is itis is inflammation. Anything that's arth is part of the bone, okay? Or it's inflammation. So osteoarthritis is different than rheumatoid arthritis. But let me say this to you. Technically, things that cause inflammation are part of in the family of arthritis. So a person can have rheumatoid arthritis, osteoarthritis, they can have lupus that affects the bones and joints, and lupus is an autoimmune disorder that causes inflammation in the body, and it can affect whatever it wants to affect, okay? And then there's gout. Gout is inflammation and arthritic type pain that comes from uric acid levels being high, but it's still arthritis, okay? So when you look at this picture up here, and the reason I like this picture, and it's a lot of stuff there, right? A lot of stuff. But I wanted you to see where pain and discomfort is and what may be the likely source depending on the location. So if you look at A is normally, right? It's right above the patella. Now, that's the reason why I started out and I showed you the picture of the bones, the ligaments, and the muscles. So you've got A is a quadriceps. I showed you the quad muscle, right? Let's see it again. See the quadriceps, okay? You may have a quadricep tendonitis. So the tendon is what pulls on the ligament and assists us to move. The tendon and the ligaments. So you may have a quadriceps tendonitis in that area. And that may be the source of your discomfort. Now, just because I'm saying these things, I'm not saying that is actually what the only thing that can cause pain in that area, okay? Because you can have a blood clot or there's so many things can be. We're just talking about in general. So quadriceps tendinopathy is damage to the quadriceps tendon, causing pain above the kneecap. The key thing is the location is above your kneecap, number one, and it's worse with activity. That's quadriceps tendinopathy or tendonitis. You can also have what's called a quads tendon rupture, a partial or complete tear of the quads tendon. It's rare, but it is a very serious injury, okay? Now, let's look at B. B is that blue area right there. It is the outer knee pain. So I'm showing you all of this stuff because if you have knee pain, what I need you to do is palpate and figure out where does my knee really hurt? Is the pain radiating from the back to the front, or is it in the front, on the lateral, medial, upper, outer, wherever? And the reason for me showing you this terminology, because it will help you explain your discomfort to the doctor. Even though they're going to do a good physical examination and they're going to send you for an x-ray. If the x-ray doesn't whatever, they'll probably send you for an MRI. Okay? So, the outer knee in the B area, there is a iliotibial band syndrome. Now remember what I said when I showed you the tib fib. The tib fib is at the bottom of your lower leg, right? Tib fib. Tibia right there, and even though it's not labeled on this picture here, the fib is the little skinny bone right next to it. So you got your tib fib. Now the iliotibial band syndrome is most common. Irritation of the thick band on the outer leg. So look here. Remember, I showed you the ligaments. There's a band. Let me see. I can't. Anyway, but just hear what the pictures. It's hard to find a picture to show you exactly, but I think you pretty much get it, okay? Now with this, pain may extend up toward the hip on the outer thigh. So, that's why the doctor asked me, where does the pain start? And does it travel on the inside of my leg or the outside of my leg? Now you understand why. It helps them know what it possibly could be. Now, next, there's a lateral meniscus tear. Remember when I showed you the meniscus? Lateral is on the outside. Lateral. Medial is the inside of the knee. Lateral, outside. That side of the meniscus. Because remember, the meniscus goes, is that cushion between the tib, fib, and the femur. That's that pillow that keeps everything comfortable and soft and all of that. Okay? So, damage to the lateral portion on the knee cartilage. It can make it difficult to straighten the knee. So a person I can't stretch out my knee. Oh, okay. There's a possibility that if you can't straighten the knee, you might have a lateral meniscus tear. Because remember, tear of the meniscus, anytime something tears, you lose the ability to move something on your own. Okay? Please remember that. If all of a sudden you cannot move a joint and you had an injury or you heard something pop, the odds are something tore. Okay? There is a lateral collateral ligament injury. Overstretching and tearing of the LCL, usually from awkward knee twisting or a large force through the side of the knee. Like the football hit you in the knee, or you're playing soccer or something such as that. But it's those awkward knee twisting, like skiers, people who ski. Very, very common to encounter such injuries. All right. Dislocated patella. Now, all these things or pain in this blue area now, the ITB, the band, the lateral meniscus tear, the LCL injury, and dislocated patella, you're going to have discomfort in the area of your knee where the blue is. And remember what I said, the patella is the kneecap. So this is where the kneecap shifts out of the patella groove, causing an obvious deformity. And people say, oh God, I broke my kneecap, or my kneecap is displaced. Yeah, it's dislocated. Just like you can dislocate your shoulder, you can dislocate your patella. All right. Number C, or letter C. When you have pain at the kneecap itself, okay? Patellofemoral pain syndrome. So that is the patella, the knee bone. Remember I said the femur was the bone that in the thigh. So there is a syndrome involving the patella and the femoral, most common caused by a problem with how the kneecap moves. There is chondromalacia patella. There's a lot. Listen, I'm just going through these things really quick so that you know that they do exist and where they would stem from. This is damage to the cartilage on the back of the kneecap. Typically affects healthy people under the age of 40. Of course, we talked about arthritis, which is wear and tear or degeneration of the knee bones and cartilage. Typically affects over the age of 60, okay? But there are people who have other arthritis. Remember I told you last week, there's post-traumatic arthritis. Anytime you've had surgery, anything, you can have arthritic pain. Housemaid's knee. I wonder why they call it housemaid's knee. It is inflammation of the prepatellar bursa, okay? Often causing localized swelling at the front of the knee. Can occur at any age, most commonly in people who spend lots of time kneeling. So people who kneel a lot, that's why they call it housemaid's knee. Okay? There is a bipartite patella where the kneecap bone is in two pieces, having failed to fuse during childhood. Now that's something that happens in children, okay? Some people don't even realize it until they get older, that it was incomplete, the fusion. All right, now let's go to D. So remember now, look at these pictures. This is more toward the middle side of the knee. The medial is toward the thigh, the inner thigh, okay, where the knees rub together. You can have a medial collateral ligament sprain, most common overstretching or tear of the MCL from knee twisting injury. Typically affects under 50s, when you're under 50. The medial meniscus tear, we already talked about that. A lot of injuries, sport injuries. Okay? Damage to the knee cartilage either through injury, typically under 50, or wear and tear, typically over 50. It's often associated with knee locking and swelling, where your knee locks and gets stuck and you're like, I can't, oh gosh, my knee is locked up. Oh, and you have to manually try to bend it and it swells. That could be medial meniscus tear. Now, these are not etched in stone. These are what could be the case. And of course, we talk arthritis is, gradual onset. We already talked about that. Okay, but arthritis, there's different forms of arthritis, and we're going to talk about bursitis and, So let's look at E. E is medial pain below the knee. So You got pain on the inner lower below your kneecap, but it's inner. Okay? Medial plica syndrome, inflammation of the synovial membrane in the knee joint, often associated with knee clicking. You hear your knee click, click, click. You're like, what in the world? There is a pes anserine bursitis. I'm just going through these, y'all. Don't beat me up. Don't beat me up. But I put a picture up there and I want to kind of at least give you an idea. Inflammation of the pes anserine bursa. It's a certain bursa. Okay? And that's a fluid-filled. So in order for our knees and stuff to move, you know, you got cushion with your disc and you got bursas. You got areas that kind of like a shock absorber, okay? Pain fell approximately 2 inches below the knee. Often is associated with a pocket of swelling. Anything, bursitis is fluid filled and can inflammation, and can be very painful. Now, F, look at the area F, pain below the knee, directly below the knee. Patella tendonitis, most common, that's the most common pain right there below the knee. And it is damage to the patella tendon, thickening of the tendon, pain worse with repetitive activities like jumping out of planes, jumping off skate. I mean, just all kind of things that we do. And there's nothing wrong with being active. But honestly, long-term exercise that probably will not cause you pain and suffering as you age, a good brisk walk. A good brisk walk with good shoes is really, really, really what we need. Now, Osgood-Schlatters disease. Now, I remember when I was in grad school, and Osgood-Schlatter, I was like, what in the world? And it's usually in children. It affects adolescents and children, typically after a growth spurt. So right after you get this kid who, especially a boy, oh my gosh, all of a sudden, they grow a whole foot over the summer. And then they get pain at the top of the shin bone, and often a hard bony lump. That is Osgood-Schlatters disease. Okay? That's all I'm going to say about that. Just remember, it's after a growth spurt and there's a lump, like this little bony lump, because of the osteophytes and the way bone is made. The bone grew so fast, I'm telling you, it was like, anyway, it's a typically after a growth spurt. Then you have your infrapatellar bursitis, inflammation and swelling of the bursa, forming a squishy lump just below the kneecap. Squishy lump below the kneecap. Remember what I said about bursa. Bursas are fluid filled, so why would it not be squishy? Yep. Osteochondritis dissecans. It's decreased blood flow to the knee bones, which leads to degeneration, thinning, and tearing of the knee. Wow. The bones and the cartilage, most common between the age of 10 and 20, okay? There's a Sinding Larsen-Johansson disease, SLJ, affects adolescents and children. So I couldn't talk about this, even though we primarily do adults. I am a family nurse practitioner, and some of these things happen in childhood that never got diagnosed. And so until you become an adult, and then they say, well, looking at the scar tissue, because I'm going to tell you what happens when you get an MRI done. You find out stuff about your body that's been like that all your life and you never knew it, okay? I had an x-ray of my right foot when I had plantar fasciitis. How about there was a sewing needle lying lateral in my right foot? The doctor said, "Come, let me show you this x-ray." And I was like, she said, "You have a sewing needle." She showed it to me. And I said, "Oh, my grandma, I stepped on a sewing needle." And it had to be. It had to be during that time. I was always running through the house. She sewed, had made quilts, and I was probably about 5 years old, at least. And that thing is still there because I'm not going to take it out. It's not bothering me, so I'm not going to bother it. So I use that as an example to say that when the doctor sends you for an x-ray, don't be surprised if you find out that there may have been evidence of something as a child that you didn't even realize because you outgrew it. And, because children are children. Now, let's go to this next one, okay? This is pain behind the knee. So we already talked about all the pain in front of the knee. Pain behind the knee. The number one. Go to A. Look where it says A. Baker's cyst. Baker's cyst? It is the most common cause of pain and swelling behind the knee. It's inflammation of the popliteal bursa. Remember what I said, bursas, fluid filled. But it's the popliteal area. Popliteal fossa is that area that you could stick your hand in behind your knee. It's a fossa, popliteal, okay? Arthritis again can set in and cause pain behind the knee. Degeneration of the knee cartilage and bones causing pain and stiffness, especially in the morning. ACL tear. Injury to the anterior cruciate ligament from twisting or force through the knee. Very common. Sport injury, usually associated with knee instability. And that's your knee is doing all kind of crazy stuff. You're trying to stand, but the knee is going, oh, shoot. Oh, no, it's unstable. PCL tear. This is injury to the posterior cruciate ligament, which is, difficult too. Less common than the ACL injury, but it can happen. It's typically injured in RTA, fall, or sports. Hyperextension injury, where the knee bends too far backwards, causing pain, swelling, and restricted movement. Now look at area B. This is the back of the knee. B is actually biceps. Excuse me. Yeah. What in the world did I do? Biceps femoris tendinopathy. There's only one thing in that area, okay? It's inflammation, degeneration, or a tear in the biceps femoris, one of the hamstring muscles. Common problem for runners, frequently misdiagnosed as ITBS. Okay, remember we talked about ITBS, and that was the around the front, the anterior part of the leg. And so a good physician, a good emergency room doctor, someone who does sports medicine. And I'm going to tell you now, sports medicine is very, very big. They have their own physical therapy and everything. But the ITB is the iliotibial band syndrome that we talked about. All right, now let's go to area C, posteromedial knee pain. Posteromedial. So it's on the back medial knee. So remember I told you medial was the inner side of the knee, but this is on the back of the inner. Okay? And that can come from, remember I showed you the hamstring, right? We showed you the hamstring right there. That is hamstring tendinopathy, inflammation or degeneration of the two hamstring muscles. There are two there on the inner side of the knee, okay? Fairly uncommon, usually affecting long-distance runners or climbers. Like people climbing steps a lot, hurt their hamstrings. Then there's the lateral pain below the knee. So you got pain on the backside outer of the knee, okay? And so let's go back to that one, and you'll see where D is located. So that's the area. Lateral head of the gastrocnemius injury. That's a muscle there. Tear of the lateral head of the superficial calf muscle. So that's your calf, is your gastrocnemius injury or muscle. Okay? And it's rarely injured in isolation. It's usually, when you injure this area, is usually associated with ligaments and or cartilage damage. So I guess what I'm trying to say, when you have a lot of knee pain, it can be very complex. And at least having an idea, the location, is it medial, is it lateral, is it anterior in the front of my knee, or is the pain worse the back? Does the pain travel up the leg, down the leg? And so if you're the type of person where you don't pay attention to your body, you really, really need to do so. It does help to narrow down and make a earlier diagnosis. It really does. And I went through this because I need you guys to be able to identify more where your pain and soreness is. Is it under my kneecap? Is it above? I mean, so this information will help. Now, E is medial pain below the knee, and that is the opposite of the lateral head injury. This is a medial head injury, same thing, but it's just on the opposite side. And usually injured when the pushing off of the foot while the knee is straight and the ankle is flexed. It's a certain way you position your leg, and it's more common in certain sports, certain things, long distance jumper, just different types of way that you flex your ankle and pushing off the foot while your knee is straight. So think about that. Your foot is flexed upward, okay, and your knee is straight, and you're pushing off, possibly like you're a diver, maybe. You're pushing, you're jumping off the diving board. All right, F. F is pain below the knee, calf muscle cramps, sudden spasms of the calf muscle. It may be extremely painful, but usually settles within a few minutes. So calf muscles, I think many people know about calf muscle stretches. You can also tear your calf, overstretching or tearing of one of the calf muscles, usually during sports. Typically instant pain with immediate swelling and bruising. Now, let's talk about DVT, deep vein thrombosis, aka otherwise known as a blood clot. This is a blood clot in one of the deep leg veins associated with intense pain, swelling, redness, heat, and tenderness. A DVT is a medical emergency and requires immediate medical intervention. You know why? Because when you have a blood clot in a artery, in a vein, you are obstructing blood flow and the tissue can die. All right, so we have covered a lot of things. I hope that this does help you. And I'm not done, because what I want to do is, we did talk about the fact that this is just a tip of the iceberg. There are so many things that can cause your knee to hurt. But the main thing is isolate. Is it acute or chronic? Chronic is 3 months or more. Acute, all of a sudden, and it less than 3 months. You can have acute pain from an injury, depending on the onset, when it started. Okay, so understanding, identifying details about your pain and discomfort helps. Or let me say this, repetitive as well. So when I work the weekend and I work those long shifts, remember I told you I cross my legs. So I get a recurrent discomfort in the lateral side of my knee. But it's pressure from sitting there for hours with my knees crossed. And yes, I swing my knee. I swing them, sometimes. I'm on the phone, I'm working, typing, that's one of my wrists. You know what I'm saying? Okay, I've got to get in front of the camera. But I'm saying it's from overuse. So what do I do about it? I rest. Oh yeah, that's what I had for you. Hold on, where is it at? There we go. I forgot I made that for you. Okay? What do we do about it? Well, first thing you do, you rest it. I'm wearing my brace. I'm avoiding a lot of repetitive movements. If it's an injury, I ice. So RICE, R-I-C-E, rest, ice, especially if it's an injury. But now for me, I'm using heat, the muscle, relax it, increase blood flow to it. I don't want to cause constriction, because it's not an acute injury where I've got broken blood vessels that's forming a hematoma or swelling up under the skin. So the main reason you ice an injury, most of the time, it's to decrease inflammation, acute injury. It's when you tore or you put pressure or you stretch something, and your body will respond to an injury. And your body does try to repair and heal itself. So if you tear capillaries, blood vessels, you're going to get blood that's going to pool up under the skin. You fall, you hit your head, you get a goose egg, right? You put ice on it to keep it from swelling, especially if you're on a blood thinner, such as aspirin, little baby aspirin, necessary for your heart health, prevent you from having a stroke. So you're the person that if you hurt yourself, immediately get some ice, an ice pack, immediately. If you don't have an ice pack or can't get an ice pack, you know what they used to do back in the day. Go in the freezer and get some a steak, or go get some frozen meat. Put a towel, and there's your ice pack. Okay? There's more than one way. See, you got an old school living. And now they have those nice ice packs that you can buy, that you just pop them and use them just like that. Okay? That you can store in your home until you need them. You can have immediate, it gets cold immediately. I forgot what the, it's a chemical that they put in there. Ugh. We used to play around with that stuff in chemistry class, but I'm sorry, I can't remember what it is right now. So, compression is C, okay? So if you injured yourself and you've got swelling acutely from an injury, they're going to say compress, and many times they'll use an ACE wrap. Like if you twist your ankle and it's swollen, you compress. Compression, you wrap it to keep it compressed so the swelling will go down. So you rest it, you put ice on it, you wrap it, and then you do what? Elevate, E. Rise, rest, ice, compression, elevation. Rest, ice, compression, elevation. That is how you treat an injury. Now, if it's chronic, guess what? You can rest it. You can put heat on it. As far as compression, support, some type of support, which you can still wrap it with compression with an ACE wrap. Many people wear those, I guess this would be compression. Yeah, it is. Compression. Yep. Rest. Heat. Compression. Elevation. When I sleep, it's up on the pillow. Okay? So, I'm not telling you anything, and you guys know I never tell you to do something that I personally don't do myself. I'm trying to see. I think I pretty much covered everything. Let me see. Oh, wait a minute. Yep, hold on. Let me go through this real quick. I did forget. Let me go over a few things, okay? I did forget. Pain can be, we talked about the Baker's cyst, cancer. Bone pain can come from cancer, especially if a person has had cancer and they have a lot. Now, wait a minute. Don't. If you know you got arthritis too, I'm not saying you got cancer bone pain. I'm talking about someone who has no previous issues with arthritis. So don't put it out there that I said that, because I did not. We did talk last week when we talked about the back. We did talk about infection in the bones. So you can get infection in the bone of the knee. Especially, hear me out, never, ever let someone inject anything in your knee, such as a steroid, without doing an x-ray first to make sure that there's no infection in there, that it's only inflammation, not infection. Let me say it again. Now you can take this to the bank. Now, Dr. Devlin said, never let someone inject into your joint. But we're talking about the knee right now. To make sure you got a joint that's swollen, hot, warm, red. Don't let them inject a steroid in your joint without making sure that there's no infection. Osteomyelitis? Never. Never, never, never. Now, if you had an x-ray a couple days ago, right, for the same complaint, and then they bring you back after a trial of this and that, oh, okay. See what I'm saying? Common sense. All right. Same complaint, though. Not that the pain is worse, significantly worse. I'm running a fever. The swelling is worse, and it's hot and on fire. They might need to do another x-ray or send you for an MRI or something such as that, okay? Now, we did talk about injuries and overuse, the bursitis, inflammation, dislocation of the kneecap. I forgot to tell you that you can fracture the kneecap, okay? We talked about the iliotibial band syndrome, and I forgot to tell you that this is the band runs from your hip to the outside of your knee. So it's a long, that's the reason why the symptoms are the way they are. The patellofemoral syndrome is pain in the front of the knee around the kneecap. And we talked about torn ligaments. Oh, and let me say this. Injuries such as the anterior cruciate ligament or the medial collateral ligament, MCL injuries, they can cause bleeding into your knee. So you can end up with two situations. So your knee is swollen because you tore the ligament and the ligament itself. So remember now, there's blood flow throughout your whole body. And they can bleed. They can tear and bleed. How do you think your body gets oxygen and blood is everywhere through you? The torn cartilage or meniscus tear, pain felt on the inside or outside of the knee. We talked about that. I'm just making sure I didn't forget anything. Strain or sprain. These are minor injuries to the ligaments caused by sudden or unnatural twisting. Right. Home care. Let's see if this coincides. And this is the last here, okay? Home care. Simple causes of knee pain often clear up on their own while you take steps to manage your symptoms. If knee pain is caused by an accident or injury, you should contact your healthcare provider. We said that, okay? If your knee pain has just started and is not severe, rest and avoid activities that cause the pain. Avoid putting weight on your knee. Apply ice. Didn't we just go through that? And it's first you apply it every hour for up to 15 minutes. So after the first day, though, you can apply it at least 4 times a day. And then after beyond that, hopefully some swelling, the inflammation stuff should start to go down by you resting and icing it. And then you can flip to some heat for comfort. But cover your knee with a towel before applying ice because you don't want to get frostbitten, right? Damage to the skin. Oh, Lord, I done went from one problem to the next. Do not fall asleep while using ice. You can leave it on too long, like I said, and get frostbitten, okay? Keep your knee raised as much as possible to bring down any swelling. Remember, that's the elevation. Then wear an elastic bandage. This is the compression I told you about. Wear an elastic bandage or elastic sleeve, which you can buy at most pharmacies. This may reduce swelling and provide support. Take ibuprofen. Oh, and let me say this. If you have any type of compression support hose, they may not be as good as, so you ain't got no money, all right? You ain't got, yeah, I said it. You ain't got no money. Improvise. Because I'm going to tell you now, those things aren't cheap. Take your support hose, cut the toe part off, and use it. You can put it on your arm if you have to. Some support is better than no support. Learn how to improvise. All right? Especially an old pair of support hose and they got to run up at the top, but the bottom part of the leg is still good. Cut the top part off and use it. I don't throw nothing. Well, yeah. I'm getting better at throwing stuff away. But if I can think of a way to reuse something, I'm on it. I'm sorry. Can't help it. Now, take ibuprofen, Motrin, or naproxen or Aleve for pain and swelling. Now, we talked about that when we talked about the back and we talked about the stomach and all of that. So I'm not going to rehash all of that. Tylenol, acetaminophen, can help relieve pain but not swelling. So that's the reason. But well, I will say this though, there is a Tylenol arthritic strength, which is 750 to 1,000 milligrams of Tylenol, okay, that has had some anti-inflammatory properties at that high dose, okay? But liver toxicity, Tylenol can cause liver toxicity. If you are an elderly person, I would say 65 and older, 3 grams of Tylenol, 3,000 milligrams in a day. I would never recommend more than that, okay? Younger people, okay? Normal kidneys, 4 grams of Tylenol. But you have to be careful and not cause liver damage. That is the reason why pain pills. There used to be 500 milligrams of Tylenol in a pain pill. People were they were killing their liver trying to get pain because the pain pill had Tylenol, too much Tylenol in it. So they reduced it from 500 milligrams to 325 for that very reason. So if you took 2 pain pills, you won't get but 650 milligrams of Tylenol versus 1,000 at one time, because there were some people taking 2 pain pills every 6 hours, right? And if your pain pills had 500, then they would try to take another pill for breakthrough pain. Too much Tylenol, liver toxicity, died, liver failure. Not good. Let's see. So that's the Tylenol, relieve pain. Talk to your provider about these medicines. Sleep with the pillow underneath or between your knees. That's good for your back too, because you keep your body in alignment. Always, and these are things, general tips to help relieve and prevent knee pain. Always warm up before exercising and cool down after exercising. Stretch the muscles in the front of your thigh, the quadriceps, and in the back of your thigh, the hamstrings. And usually what I do before I walk or run, because I, had started back running some, I stretch and touch my toes and stuff like that. Just do some, stand up and touch my toes a few times and stretch really good before. And then I walk fast, couple of laps, then I run. And then I run, and then I may walk and before I'm done, and then stretch again. I go get on machines and exercise my muscles. So you have to be very careful, but that ain't had nothing to do with my wrist. That was work related. Oh well. Avoid running down hills. Think about the pressure you're putting on your knees running down a hill. Gravity as well. The way you're landing. Don't run down a hill. Walk down a hill instead. Bicycle, or better yet, swim instead of running. Swimming is excellent exercise. The buoyancy of the water takes pressure off your joints. But you're exercising every muscle. Yep. Reduce the amount of exercise you do if you have some discomfort. Didn't say stop, just reduce. I had to quit lifting so much. I was trying to lift too much. I was trying to build up muscle too fast and hurt myself. I didn't hurt myself, but I knew I would, I was smart enough to know what I was doing wrong. Run on a smooth, soft surface such as a track instead of on cement or pavement. Yep. Lose weight if you're overweight. Every pound, which is 0.5 kilograms, that you are overweight puts about 5 extra pounds, 2.25 kilograms of pressure on your kneecap when you go up and down stairs. Now, that one I'm going to read again. Oh, the amount of extra pressure is even greater when you jump. Now, let me read that again. Every pound, which is 0.5 kilograms, that you are overweight, not obese, just overweight, puts about 5 extra pounds, 2.25 kilograms of pressure on your kneecap when you go up and down stairs. So if you anyway, the amount of extra pressure is even greater when you jump. So jumping downstairs, or remember when we were a kid and we jumped down, anyway. It's a lot of things that we think about, we do, and we don't realize eventually 30 years later how those things will catch up with us and cause injury. Remember what I said to you last week when I was talking about my plantar fasciitis. It says, if you have flat feet, try special shoe inserts and arch supports or orthotics. But if you don't know you got flat feet, oh well. And make sure your running shoes are well made. We talked about that last week. Fit well and have good cushioning, because we talked about the feet as it related to the back, but we skipped the knee. So tonight, woohoo, we did the knee. And the subject was, are you needing me? Yeah, I need my knees. All right. Well, God bless each and every one of you. Thank you for hanging out with me, Dr. Anna Devlin. I am a family nurse practitioner, and I love what I do. So I am so thankful for the comments. I do apologize. I'm not able to read them while I'm presenting. So I wasn't able to respond immediately, but I did reply, I think. And I think we pretty much covered it by talking about the knee tonight. And if there's any additional, I was going to put my email address up there, but we'll fix that. We're a work in progress, remember? All righty. Well, God bless each and every one of you. This is SHEM 2, Spiritual Healthy Enlightening Mandate Ministry, part of SHEM, Souls Honoring Elohim's Mandate. And thank you for joining me. Like I said, I had a hard time with the lighting. The lighting is the issue. I'm just going to bring, sometimes, I'm just going to have everything set up here at home with a spotlight. I'm going to get me a spotlight. That's right. So we won't have these problems. All right. God bless. Thank you. Oh, we'll be back. Excuse me. We'll be back on Sunday. Pastor Devlin and I. It'll be our Flow in the Word on Sunday. All right. Don't just be blessed. Don't just be blessed, but be a blessing to God's people. Adios, amigos.